Hey, it's Ashley from Demystifying Your Health. Welcome! Thank you for joining me today. Today we're going to be talking about urinary tract infections. Obviously they're not fun, but they're very common. So how do you get one? How are they treated? But more importantly, how do you prevent one? Urinary tract infections are also called UTIs. Typically they happen when the bacteria enters your body through your urethra, which is the tube that connects your bladder to the outside of your body, and then the bacteria multiplies inside your bladder. Your bladder and your urethra make up your lower urinary tract. It's important to note that UTIs can actually occur anywhere in the urinary system, including your kidneys and your ureters. The ureters are the tubes that connect your kidneys to your bladder. Symptoms also depend on location that's affected. Most commonly, you're going to have strong, persistent urge to urinate, a burning sensation when urinating, discolored urine, which means it can even be blood-tinged, cloudy, some people even pass blood clots, strong smelling urine, passing small amounts of urine, and pelvic pain. If the infection spreads more throughout your body or to your kidneys or somewhere along those lines, you might also have back pain, fever, nausea, vomiting, shaking, and chills. Certain things can increase your chances of having a urinary tract infection. The most common thing is being female. Just because of anatomy, your urethra is shorter than men's, so bacteria have less distance to travel to get to the bladder. Another common reason is sexual activity, certain types of birth control such as diaphragms or spermicidal agents, menopause, urinary tract abnormalities, blockages in the urinary tract such as kidney stones or enlarged prostate, a suppressed immune system, or a recent catheter use or urinary procedure. When it comes to treating a UTI, there are several different things, but the most important is antibiotics. And this is going to be specific to the bacteria that's actually causing your infection. To determine this, you're going to need to go to your doctor's office and give a urine sample so they can run tests. Most likely, the tests don't come back for a few days, so they're going to give you a prescription to start taking, but you might need to switch to a different antibiotic if it's a different type of bacteria that's causing your infection. And the other big thing is pain medicine, and there's a specific pain medicine called pyridium, which is used for urinary tract infections. And this helps to reduce that burning sensation in lower pelvic pain. The only big thing with this is there's a side effect of it turning your urine a nice bright orange color. And this can actually stain clothing, so just be careful when you're taking it and keep that in mind. You can also try using a heating pad over your lower abdomen. Sometimes this helps with any of that pain and cramping feeling. And you want to be sure to drink plenty of water because this helps keep you hydrated and it helps keep flushing your body of any bacteria because you're going to be urinating more. But avoid coffee, alcohol, soft drinks, or citrus drinks because these can actually make your symptoms worse. Some people try cranberry juice, and while it can help maybe relieve symptoms, it's not going to get rid of the infection. The only thing that's going to do that is the antibiotics. But if you want to use cranberry juice, that's up to you. Just be careful if you're on any blood thinners like aspirin or warfarin or something like that, because cranberry juice does impact this. When it comes to preventing UTIs, there are several things you can do. The first and most important is drink plenty of water. When you're hydrated, you're going to have to urinate more frequently. When you urinate more frequently, you're flushing bacteria out of your body. So this is a really good thing. The next is empty your bladder soon after intercourse or getting out of a hot tub or something like that, because bacteria just naturally is going to travel and you want it to flow outward, not inward. Particularly for women, you want to make sure you're wiping front to back and avoid irritating feminine products like deodorant, sprays, or powders. Also, if needed, change your birth control method, because obviously this can also put you at an increased risk of having a UTI. Urinary tract infections are not fun to have, and unfortunately, even if you do all of the preventative measures, you can still end up with one. But the good news is, with the proper treatment, you'll be feeling better in a few days. Thank you for joining me today. Like and subscribe below. Share us on social media. If you have questions, comments, put them below as well, because I'd love to hear from you. Until next time, stay healthy.